Well, there are fears the US media is covering up the possible side effects of the swine flu trial vaccine. 28,000 human guinea pigs are set to test the jab, but news outlets have so far kept their snouts clean over its link to a rare brain disorder. And for more on this, we're now joining our correspondent in Washington, D.C., Priya Sridhar. Well, Priya, over to you.
Thanks. Well, swine flu, or the H1N1 virus, has dominated headlines this past year, and World Health Organization officials have called it a public health emergency of international concern. Officials have predicted that up to 2 billion people will eventually be infected by this virus that was detected in humans earlier this year. So far, around 1,500 people have died from it, and many have said that it's the first pandemic of this century. So now, as countries are planning their vaccination campaigns, it seems that there's a new threat to look out for. It's called the Guillain-Barré syndrome, and it's been linked to previous swine flu vaccines from back in the 1970s. Well, joining me to discuss this is Barbara Fisher, CEO and founder of the National Vaccine Information Center. Barbara, thanks so much for joining me.
Thanks for having me.
First of all, if you could tell me a little bit about what exactly is this syndrome and why has it been linked to the previous swine flu vaccines?
Well, Guillain-Barré syndrome is an inflammation of the nerves, and you start to have paralysis in the legs. It works its way up. You can have total paralysis. You can recover from it, or you can die from it, or be permanently paralyzed. It's been associated with influenza vaccines in about 1 in 100,000 shots. So with the swine flu vaccine in 1976, there were about 40 million people in the U.S. who got that vaccine in 76. About 500 cases of Guillain-Barré syndrome and 25 deaths. It actually caused more cases of GBS and death than the swine flu that went around that year.
So is this vaccine that's going to be offered in many countries in October, is it the exact same one that was offered back in the 1970s?
It's not the exact same one. It's a relative of that. This new swine flu vaccine is a human-bird swine hybrid virus that will be contained in this vaccine. So it's a relative of the 1976 strain.
And I know that there was an interesting development in the past 48 hours that you were telling me about. Can you just tell me about that again?
Well, in Britain, there's been a lot of publicity about this association of swine flu vaccine with Guillain-Barré syndrome. And in fact, a memo has gone out to the doctors in Britain, from neurologists in Britain, warning them to please be on the lookout for cases of Guillain-Barré syndrome after the swine flu vaccine is rolled out and given to many people in Britain. We also have an interesting development in the healthcare workers there. Two-thirds of the nurses there who were polled have said that they will not be taking the swine flu vaccine, which is very interesting. No poll like that has been taken in the United States, but there is a lot of concern about the potential reactivity of this swine flu vaccine versus the relatively mild to moderate symptoms associated with this swine flu right now.
And so how exactly will this vaccine be dispensed? Will it be mandatory, and what should people know exactly about it before they choose to take it or not?
In the United States, it will be given a national rollout come October. That is, the plan is to actually vaccinate children in the schools, which has never been done in this country since the 1950s when we vaccinated for polio vaccine. It will be available in pharmacies and grocery stores in non-traditional medical settings. We're very concerned that there won't be enough monitoring, enough recording of who gets the shots, what manufacturers, the lot number, etc., and we won't have a way to really keep tabs on how many reactions are occurring.
Well, Barbara, thanks so much for joining me. And as we get closer to October, we'll all be keeping our eye out to see what exactly there could be as far as side effects with these vaccines. But for now, back to you in Moscow.
All right, Priya, thank you very much indeed, and we'll see you later.